Good evening. This discussion is about the special needs of the homeless and indigent in the poorest sector of our state, the seven-county area known as the Wiregrass region of Alabama, and what this legislation can do to begin to help to rectify this situation for many of our residents who are facing this dilemma. We'll be utilizing the packets that we handed out at the beginning of the presentation. Wiregrass Health Companions, a rural health facility who serves the population of indigent and homeless, believes this solution to be in the best interest of the homeless and indigent population and the 7 counties of the Wiregrass region. WHC also believes that this proposed solution will relieve the many residents who are both homeless and indigent and in need of medical care in this 7-county region, as well as reduce the overall cost to those counties for medical care rendered to those recipients. Homelessness is a major issue in the state of Alabama. It is of great concern in Dallas County and the surrounding counties of Watauga, Wilcox, Lowndes, Hale, Marengo, and Perry. These are the poorest counties in the state, and they are in need of your assistance most. Homelessness is identified as a major public issue and threat. It is a crisis that is more profound than reality TV, and it is playing on the streets of our communities every day. The homeless men, women, and children of our nation are living with disabilities and chronic conditions that are going to be untreated and in many instances unnoticed. Wiregrass Companions is requesting the help of the legislation to make it the policy of the state of Alabama to provide funding via local and state governments to provide for the provision of housing and medical care for the current population of homeless and indigent in that 7-county area. This organization is asking the state of Alabama for funding to provide 7 mobile units totaling $4.2 million to travel throughout the region each day to provide mobile unit care for medical conditions for this special population. These units will increase services each year until reaching a maximum capacity of 5 days per week. The rural health clinics, Wiregrass Health Companions, will be utilized after hours and on weekends in an urgent care capacity to provide a continuity of care in the counties that they serve. This requested $4.2 million would provide for the units, the purchase of the needed equipment, as well as staffing for the first year alone. No other funding should be required from the legislature. These units will also visit local housing units for the homeless and indigent each week for the management of medical, OBGYN, and dental services to the residents of those units, as well as those who are in need in that area. Some of these medical services are volunteered by the medical staff and nursing staff. The physicians are family medicine practitioners and can therefore provide care as both medical and OBGYN practitioners. The allocation distribution is found in Exhibit 1 on the following page. That would be page 4 in your handout. As you can see, there are 7 counties listed. The mobile unit cost is in the first column. The equipment cost is in the second column. And the cost of salaries is in column 3. The total cost would be $4,169,050. That is how we came up with the $4.2 million that we're requesting. Some of these funds have been donated already by the city in the form of mobile units, and some of it has not. This would have increased the amount requested, but as you can see, the cities have already become involved. Some of the equipment was also donated by physicians. As we see here, the total funding has already been offset by the local governments participating in the program, as I've already stated. Many of the cities have already been utilizing mobile units with equipment on board, but not regularly. The rise in the need for services to the homeless and indigent in the 7-county area has prompted the need for more aggressive effort. We have all been preparing for helping the homeless in that we offer temporary housing in each county, and that is on 2 levels. Those levels you are very well versed in and aware of. The third level that is missing and has been missing is a level that offers medical care to the special populations to prevent inpatient days or recurrent admissions to the hospitals because of the lack of follow-up upon discharge, and including offering medications to this population free of charge. 80% of the population served in these counties have diabetes and hypertension. These two diagnoses are our target population for the Stanford University team. According to the Alabama Department of Public Health, there are nearly 500,000 Alabamians with diabetes. We've been able to utilize Stanford University School of Pharmacy to help us with this endeavor, free of charge to the indigent and homeless. That which remains is for the legislature to pass the policy that will provide for the use of these mobile units for the next 5 years in this area. We're asking for the funding for this program in part from the state of Alabama and partially by monies earned by the mobile units for the work of the units in the communities that we serve. Please see the attached exhibit that will show the anticipated capital earned in 2016. That is based on the earnings from the units in 2015 that are already in operation. Those units that are bearing the symbol of the asterisk are proposed based on county size and reported incidents of homelessness and indigence. This item is listed as Exhibit 2. Please see this exhibit on the following page. If you take a look at that exhibit, you will see that there are 3 clinics, Perry, Lowndes, Hale, that are proposed units and their anticipated earnings for 2016. This is based on the size of the county again and the number of homeless and indigent in that county. All of the charges are based on a sliding scale. It's based on the amount of money that these families earn, and in some cases, the actual charges are absolutely free. If you notice, the maximum charge per cost per visit is approximately $25 if they have no labs, $13 if they do have labs, and in some cases we're utilizing the health department and those lab charges are absolutely free. It just takes a lot longer to get your results back. Looking at the actual exhibit, you will see that the average day is 30 visits. We do anticipate those visits will rise over the next year to 2 years. If you look at all of the counties, each county is broken out, telling you the anticipated number of visits per day. The total charges in 2015, or total earnings in 2015, were $650,780. We believe that by increasing 1 extra day per week, we will earn an extra $162,695 per unit for the units. That will bring in 2016 a total of $813,475 for the total units operating only 4 days. In 2017, we will reach almost $1 million earned each year at $976,170. Please keep in mind these are only the medical staff fees. This does not include dental services. Once the dental services are in effect 3 days per week, then 4 days per week, these numbers will triple. These units will increase to run 4 to 5 days during 2016 with the funding that your policy will allow. It will house the pharmacy students and instructors in those counties, along with the free pharmaceuticals that they will offer as a part of their training program for diabetes and hypertension. And in choosing these 2 diagnoses, we will include heart disease as well. These units will be manned by the RN and the physician, the MD, as well as the dental staff at least twice weekly. None of our proposals are inclusive of dental staff at this time. The anticipated earnings from a dental program are pending, but we do expect it to exceed double, perhaps triple the amount that we're looking at in Exhibit 2. With all of this having been said, the figures speak for themselves. in terms of financial solvency. We can see a steady increase in funding as we increase days that each unit is in the community. We also believe that the days in the community and the medication program offered in collaboration with the Stanford University Pharmacy Program. With that, we have an opportunity to reduce the recurrent admission rate for this population by 50% or more in the first year alone. This is an opportunity for each legislator to make a difference in the counties they serve, and we're very proud to offer this to you as a very visible sign of your involvement in your communities on the ground level. Thank you very much. On behalf of Wiregrass, thank you.